So what are the objectives of our presentation? The objectives are, so we have to know regarding what is glycosuria and its type. Mainly we are having three types of glycosuria. One is alimentary glycosuria. The second one is the renal glycosuria. Third one is the diabetic glycosuria. The first one is, so first we have to define regarding what is glycosuria. We should understand the concept of the glycosuria. Normally, the urine contain about 0.05 gram of sugar. So how much the urine contain? So mainly 0.05 gram of sugar. Such a small quantity cannot be detected by the Benedict test. So when there is a less amount of sugar in the urine, that may not be detected in the investigation of Benedict test. But under certain circumstances, a considerable amount of glucose may be excreted in the urine. If patient is having any problems related to kidneys or related or other condition, what will happen? Small amount of sugar is going to be excreted in the urine. So excretion of detectable amount of sugar in urine is known as glycosuria. So what do you mean by glycosuria? There is excretion of detectable amount of sugar. Detectable amount of sugar in the urine, it is known as glycosuria. So glycosuria results due to rise in blood glucose above its renal threshold level. So what is the normal renal threshold level? 180 milligram. So let us see once again. Glycosuria result due to rise in blood glucose. Rise in the blood glucose above its renal threshold level. So what is the normal renal threshold level? 180 milligram. So renal threshold, we can see the concept here. Renal threshold level is a concentration of a substance dissolved in the blood above which the kidneys begin to remove it into the urine. So normal renal threshold we can consider as a 180 milligram. Once it is crossing the glucose level in the blood, that is going to be excreted by the kidneys. So it may be due to various reasons on the basis of which it is classified in the following groups. So what are they? Alimentary glycosuria, renal glycosuria, and third one is diabetic glycosuria. Elementary glycosuria. So the blood sugar level of some individual after meal rises rapidly above the normal renal threshold. Usually the concept is after eating, normally our blood glucose level will be rising. So that is a meaning here. The blood glucose level of individual after meal rises rapidly above the normal renal threshold. So normal renal threshold is 180 milligram and it results in glycosuria and known as elementary glycosuria. So this is due to an increased rate of absorption of the glucose from the intestine. So the name is indicating like elementary glycosuria, intestine. The word is relevant to the intestine. This is due to an increased rate of absorption of glucose from the intestine. This is called elementary glycosuria since elementary canal is involved. So why we are considering as elementary glycosuria? Because there is involvement of the intestine. The characteristic feature of this glycosuria is that usually high blood glucose level returns to normal in 2 hours after meal. Initially, there is a raising of the blood glucose level. After 2 hours, the blood glucose level may be decreases. This type of glycosuria is benign. Sometimes it may be harmless condition. Another subtype is renal glycosuria. Renal means kidney. This is observed due to impaired regular reabsorption of glucose. Reabsorption. There is a failure of reabsorption of the glucose from the kidneys and have lowered renal threshold, maybe 130 to 150 milligram per glucose. In such cases, the blood glucose level is below 180 milligram. That is below normal renal threshold for glucose, but glucose appear in the urine due to lower renal threshold. Renal glycosuria may result from inherited defects. Inherited may be genetic abnormality in the kidneys or it may be acquired as a result of the kidney diseases. The third one is diabetic glycosuria. Because of the diabetic condition, the person maybe there is a presence of the sugar in the urine. Diabetic glycosuria is a pathological condition and is due to deficiency of lack of insulin. So why this problem is arising? Because of the deficiency of lack of insulin, which causes diabetes mellitus. Although the renal threshold is normal, as blood glucose level exceeds the renal threshold, the excess glucose passes into the urine to produce glycosuria. So what is the concept here? Although the renal threshold may be normal, as blood glucose level exceeds the renal threshold, the excess glucose passes into the urine to produce glycosuria. So let us summarize our topic. Till now we have discussed regarding what is glycosuria. The glycosuria is defining as the presence of abnormal glucose in the urine. It is known as glycosuria. So mainly we having three types are there. So what are they? Alimentary glycosuria, renal glycosuria and diabetic glycosuria. Alimentary glycosuria because of the involvement of the intestine. Renal glycosuria because directly there is a problem in the kidneys. It may be inherited or acquired. Diabetic glycosuria because of the insulin, lack of secretion of insulin or unavailability of the insulin in our body. There is a deficiency for insulin. So that is known as diabetic glycosuria. I hope my dear students you understood the concept of glycosuria. Have a nice day. We meet once again.